Type 2 diabetes. The school nurse, when available, is the most appropriate person in the school setting to provide care for a student with diabetes. However, many schools do not have full-time nurses. Even for schools that do, the nurse may not always be available during the school day, during a school-sponsored extracurricular activity, or available during field trips to assist with routine care and emergency care. Trained school personnel must be available to perform and assist the student with diabetes care tasks. This presentation is not intended to provide legal or healthcare advice. Please consult with a legal or healthcare professional regarding your specific questions or needs. Each training component was created specifically for school nurses and other qualified healthcare professionals to train school personnel. This unit is Type 2 diabetes. Type 2 diabetes, formerly called adult onset diabetes, is the most common form of the disease in adults. However, people can develop type 2 diabetes at any age, even during childhood, but risk for type 2 diabetes increases as people get older. Increased risk is notable after the age of 40. A progressive disease, type 2 diabetes usually begins with insulin resistance, a condition in which cells do not respond to insulin properly. At first, the pancreas keeps up with the added demand by producing more insulin. Over time, however, the pancreas loses its ability to make enough insulin to control blood glucose levels after meals, overnight, or during periods of fasting. Managing type 2 diabetes requires maintaining a healthy weight and/or weight loss if overweight. Lifestyle changes, such as making healthy food choices and getting regular physical activity, are essential. In addition, people with type 2 diabetes may take insulin and/or other blood glucose lowering medications to manage their diabetes. Symptoms of type 2 diabetes may be similar to those of type 1 diabetes. A person may feel very tired or thirsty and urinate frequently due to high blood glucose levels. Other symptoms include unexplained weight loss and blurred vision. High blood pressure and elevated blood lipids or cholesterol are associated with insulin resistance. In addition, physical signs of insulin resistance may appear, such as darkening of the skin around the neck, armpits, or groin, which will also look thick and feel velvety. This condition may be mistaken for poor hygiene. Some children or adolescents with type 2 diabetes may not have recognized symptoms when they are diagnosed. For that reason, it is important for the parents or guardians to know the risk factors of type 2 diabetes and to talk to their healthcare professionals about screening children or teens who are at risk for type 2 diabetes. The key risk factors for type 2 diabetes in youth begin with genetic risk, which is easiest to identify by having a family member who has type 2 diabetes. Other risk factors include eating a diet with excess calories and having limited physical activity, leading to being overweight or obese. In addition, type 2 diabetes is more common in certain racial and ethnic groups, such as African Americans, Hispanics and Latinos, American Indians, Alaska Natives, Asian Americans, Native Hawaiians, and other Pacific Islanders. Other risk factors include having a mother who had diabetes during her pregnancy, having high blood pressure, high cholesterol, abnormal lipid levels, polycystic ovary syndrome, and being inactive. For children and teens at risk, healthcare professionals can encourage, support, and educate the entire family to make lifestyle changes that may delay or prevent the onset of type 2 diabetes. Changes include reaching and maintaining a healthy weight by making healthy food choices and engaging in regular physical activity. A number of measures can be used to keep students with type 2 diabetes healthy and safe. Those include losing weight if necessary and/or maintaining a healthy weight, increasing activity if sedentary, managing glucose in the target range, eating healthy, and taking medications as prescribed, which may include insulin. Type 2 diabetes management at school may include lifestyle interventions, oral medications, and/or injectable medications including insulin. Some students may require blood glucose monitoring and medication administration in school, similar to students with type 1 diabetes. However, many others do not. Children requiring monitoring or treatment during the school day should have a DMMP in place. For all youth with type 2 diabetes, school nurses and other school staff can help guide students on choosing a healthy, balanced diet and appropriate levels of physical activity. Social and emotional support should be provided as needed. School nurses and trained diabetes personnel should be aware that youth with type 2 diabetes may present with urgent care needs, like children with type 1 diabetes. Youth with type 2 diabetes who are on insulin can be at risk for hypoglycemia, though it is less common than in youth with type 1 diabetes. Similarly, youth with uncontrolled type 2 diabetes may present with signs of hyperglycemia, ketones, and diabetic ketoacidosis. For hyperglycemia and ketones, treatment should proceed per the student's DMMP, which may include notifying their healthcare provider for guidance. If you suspect diabetic ketoacidosis, urgent medical evaluation is needed. Although there usually are no forbidden foods for people with diabetes, students are advised to avoid liquid carbs such as sugar-containing sodas and juices, including 100% fruit juice. The liquid carbs raise blood glucose rapidly, contain a large amounts of carbs in small volumes, are hard to balance with insulin, and provide little to no nutrition. Many students with type 2 diabetes follow a meal plan designed to help them achieve a healthy weight. These students may be prescribed a calorie target for the day as well as consistent carb amounts to aim for each meal and snacks to help manage their weight and blood glucose. This ensures that healthy food such as whole grains, low-fat protein and dairy, fruits and vegetables are available and critical to their diabetes management. Encourage all students to maintain a healthy lifestyle by adopting healthy eating habits and engaging in regular physical activity. Maintaining a healthy weight is very important for students with diabetes to help manage blood glucose levels and to establish habits for managing their weight as they grow older. Healthy habits include being active every day and choosing healthy foods for meals and snacks. More children and adolescents in the U.S. are either overweight or obese than ever before. This excess weight is placing more students at risk for type 2 diabetes. School personnel can help all students reach and maintain a healthy weight by encouraging them to make healthful lifestyle choices while they are young. They also can provide non-food rewards and encourage healthy foods for class parties.